as it related to the delays in having results. In addition, the Prime Minister spoke to other issues, including the possibility of introducing shopping utilizing the alphabet. This report yesterday evening has generated a lot of discussion. And indeed, in spite of the explanation as it relates to the delays in results, persons have continued to bombard the Ministry of Health and Wellness with calls. And of course, there has been much discussion on the whole matter of the alphabet shopping. There are a number of other issues, and we propose to discuss all of them this evening. First, I will begin with the most popular one, if I can put it that way, as it relates to the introduction, the possible introduction of alphabet shopping in relation to supermarkets and other stores. This morning, the Prime Minister convened a full meeting of the Social Partnership, and BAP was represented indeed by the President and other members, and presentation was made because, as you recall, BAP has been advocating for a number of recommendations in terms of restricting movement of persons in Barbados. There was full discussion. We heard the views of all sides, of BAP, of the trade unions, of the private sector associations, and then the subcommittee deliberated and came to the agreement, after examining all of the matters raised and the issues and the concerns, that the introduction of shopping utilizing the alphabet would not be introduced at this time, that it wasn't necessary at this time to do that. BAM had also raised other issues as it relates to their concerns relating to what they saw as relaxing sort of in some businesses, not all. And they asked that for the assistance in contact tracing, that they noticed that some businesses were doing it, but others were not doing it, asking persons to write their name or to give a telephone number, and that indeed in some entities there was just hand sanitizing, but it seemed as though the screening of temperatures had disappeared. They advocated for the use and utilization of more online shopping and curbside pickup for groceries, especially for the elderly and those who might have some chronic diseases. In addition, they encourage the need for businesses and establishments to pay more attention to the square footage and adhere to the 6-foot 2-meter rule as it related to distancing, social distancing, especially in supermarkets and in restaurants. I want at this immediately to put to rest the notion that has somehow gone abroad that BAP and the government or the Ministry of Health are at odds as it relates to the matter of the management of COVID-19. They could be nothing further from the truth. BAP has participated in the meetings of the Health EOC from time to time, and they have agreed that they will again be very active in that Health EOC. In addition, many members of BAP have volunteered to be of assistance as it relates to the dissemination of reports and results and playing a more active role within the Ministry of Health and Wellness at this time, recognizing the urgency and the importance of the current situation. The delays with results. The Prime Minister and the Minister of Health and Wellness, they both apologize and raise the issue of systems failures between the 2nd of January and the 8th of January, which has resulted in delays in persons obtaining results, especially negative results. This affects all levels. It affects and is affected as it relates to contact tracing to some extent, as it relates to Barbadians who return to Barbados and who are longing to see their families and are being quarantined either in government facilities or indeed in hotels, and of course visitors to Barbados who expected to be out of a hotel, for example, for 3 days, for 5 days. They have made allowances for this, and then with this current situation, they then have to stay longer in those hotels, depleting, of course, their resources and not being able to benefit from all that Barbados has to offer. I said that the government has apologized, and I again this evening apologize sincerely and profusely on behalf of the government of Barbados for this mishap and this situation where we have these delays in getting results out. And we are not running away from it. We are not running away from the situation. It was addressed yesterday by the Prime Minister. We have brought on additional data entry people in the polyclinics. We've already recruited 4 additional doctors to work to be based in the lab, the Best of Santos lab, to be responsible for disseminating results to various groups, to the private sector, to those who are in quarantine, to those who are in hotels. We have gone further, and we have enlisted the support of volunteers I mentioned from BAP to work at the ministry to assist with the dissemination of these results and to ensure that we can become current as soon as possible. In addition, doctors have also been recruited to assist in the polyclinics, assisting the medical officers of health who are now burdened with the testing and other responsibilities to allow them to do this and allow the functions of the polyclinics to continue. We are working on this. But Barbadians, ladies and gentlemen, it is almost like a perfect storm. Here we were going along in December and moving along with a normal situation where information was being manually entered. A person would be swabbed at a polyclinic. The information, the details would be written on a form which would accompany that specimen to the lab, to the Best of Santos lab. We were developing technology concomitantly, a shape app, which would allow the transmission, that data to be entered into a computer system and transmitted automatically to the Best of Santos lab. This system was also to generate the results automatically and have them distributed by email. We had issues, and there we were, as I said, in December, going along and introducing this app. We had a schedule of training for all of the polyclinics to be completed, ironically, by the first week of January. Then came this surge in cases. It put our system on the strain, but we saw this as an opportunity to introduce this app to bring greater efficiency and speed to the entire process. Initially, we had connectivity issues at some of our polyclinics. And then we discovered that there were problems with an undersea cable, a ruptured undersea cable, which was affecting our entire process. And this essentially, as I said, was a perfect storm in terms of our being able to function. So we recognize these issues. They are being addressed. But in the meantime, we've brought in 3 people to address them, recognizing that these matters have to be addressed and addressed urgently. The Prime Minister spoke yesterday, and I reiterate and reinforce that we will have 2 teams within the Ministry of Health and Wellness. Those who will be working in conjunction with the lab in ensuring that results from the 7th of this month, that those results, 7th and 8th, should all be ready by tomorrow. There will be another team, meanwhile, working in trying to get out the results that were there before that date. So we're working collectively in doing this. Ladies and gentlemen, having explained this, again, we are addressing it. We apologize sincerely. We understand the difficulties, how it affects persons as it relates to their holidays or being unable to see their relatives and incurring additional expenses. But I must caution that this issue is not unique to Barbados. Sometimes some persons in Barbados believe that this is the perfect place. It is not. We might try to get there. It could be an aspiration. But many of these problems which we are facing with delays in obtaining results are the ones that bother and that first developed countries, first world countries, cannot manage at this point in time. Myriad of the stories of persons in Canada, in the United Kingdom, in the United States, and many of you have relatives who can attest to the difficulties in getting test results. Indeed, as it relates to Canada, for Barbadians coming back to Canada, the requirement of having the PCR test 72 hours before arrival in Barbados, we've had to put that in abeyance, as it is impossible for the average person to get a PCR test result in Canada within less than a week and sometimes 2 weeks. In Jamaica, when they reopened to tourism, they had an app, they were speaking about the tests being needed, and they had to abandon the entire process because within 4 weeks, they recognized that it was impossible, that you had backlogs of results for 2-3 weeks. The United States, you've all heard the stories in getting results urgently. I've heard persons report that they did tests in the United States, they came to Barbados, had a test at the airport, went into quarantine, and got their results in 5 and 6 days in Barbados, while still waiting for the results of the test that was taken in some parts of the United States. And we all know the situation as it pertains to the United Kingdom and their management, recognizing almost being impossible to provide test results in an adequate time, that they went to a situation where persons were tested and you were advised to stay at home, and you would relate to your doctors in terms of if you felt well or if you were feeling sick, then you would call a number, you would call the clinic as provided for you. So I want to make it clear, we accept that we're having difficulties in this area of dissemination of reports and results. We are addressing it. We are addressing it assiduously, but some of the concerns are out of our hands. We do not repair underwater cables, but we can do all of the things in the interim to ensure that results become available and in adequate time. I also want to say at this time that it is the government's commitment. There was the description of various categories last evening, and that we will prioritize, of course, those persons who are primary contacts. We see those as an immediate priority. And all of the other areas covered in Category 1, the protective services, the health services, the fire service, the prison officers, those who work in customs and immigration, and of course the elderly in elder care homes and of course those in hospital. These are the Category 1, which we are committed to ensure that they get their results within 24 hours, and these are the ones that we are committed to right now. In addition, as I said earlier, to moving the backlog and getting the results out from the 7th and the 8th, and indeed by tomorrow. That is how we are dealing with that. The matter of Barbadians and visitors to the island who have been put at a disadvantage financially that I mentioned earlier, the Minister of Tourism is here and she will speak specifically to that matter. Last week, at the height of the crisis, we announced that polyclinics were going to be open on Sunday, Monday, and Tuesday for the purposes of persons who were in contact, might have been in contact with persons who were in contact with persons who were positive for COVID. I thank Barbadians for the numbers that came out, but it also placed additional pressure on the entire process. And we are now doing swabbing at polyclinics, but as I said earlier, we're going to utilize the categorization. Those, as I said, in Category 1, we are looking to guarantee your results in 24 hours. Those in Category 2, we're looking at 36 to 48 hours. Those in Category 3, we look at longer periods of time. And these details were outlined, and they will be distributed to the press. Some persons have expressed concern about the prisons, and the prison officers in particular, recognizing that at the beginning, we'd separated prison officers who were not on duty. We'd put them into quarantine in various hotels, and we had prison officers stationed doing rotating shifts with the assistance, of course, of the Barbados Defense Force. They have had their second test. I believe most of them have had their second test. And getting their results out is one of extreme importance. There was a Worthing Hastings police station, and those police who were involved have all had their results. And we're moving now to get the prison officers who were affected getting their results out. I mentioned some quarantine issues last week, and I'm pleased to say that the COVID monitoring team has reported that they've seen definite improvements in how quarantine is being managed at hotels. Of course, the enforcement now that visitors not in quarantine hotels be expected to stay in their rooms until they get their second test and are cleared, that has also helped the situation. You would have seen in the press a number of persons being charged for breaking quarantine, and there are others who are presently in isolation who will be charged when they are discharged from isolation. There have been stories, and the social media is very busy, about the isolation facilities at Harrison's Point being full and there's no way to put people who need to be isolated. This is certainly not true. This is pure mischief. And in any case, Harrison's Point, which has a capacity of 220, when I checked earlier today, I had about 125, I believe, I could be a few out, persons there. We had also brought into use the Blackman Gollop School and have been able to accommodate, not presently, but at one stage we went to as much as 102 persons being there. I understand now that it is around 90 who are there. And of course, those prisoners who are being quarantined, who are being isolated within Dodds Prison. So the story of Harrison's being overcrowded and full and we have no way to put persons is not true. There have been pictures going around about the food at Blackman Gollop. This is regrettable. I understand the situation where you've had a situation where at the beginning of the day you're catering, for example, 34 people, and by the evening, with new admissions and transfers, you reach 65 or 70 persons. And then the kitchen, the hospital QH kitchen, which provides this, then has to scramble to provide meals. That has been addressed. That has been addressed. And I don't expect to see any videos or photos of substandard meals at Blackman Gollop facility this evening or for the ensuing time. Finally, before I go introduce the others to speak to you, I need to say that the numbers, as I said, have stabilized, and we get the impression that they are decreasing. Dr. Best will speak specifically to those fine details as it relates to the numbers. I'm not going to get into that. That is his forte. He will also speak about the clusters. We are hearing this talk sometimes about these clusters as though there's this runaway and rampaging numbers of clusters in Barbados. Ladies and gentlemen, that is far, far from the truth. And Dr. Best will speak to that in more detail. At this point in time, I want to reassure you that we in the government, and indeed in the subcommittee, COVID subcommittee, have this and are managing this. We have had hours and hours of meetings. The Minister of Health and Wellness and the Chief Medical Officer are not here this evening because after a number of meetings to address a number of issues, they are now in the Ministry of Health, in the HEOC, dealing with some of the issues, ensuring that results are going out as expected. And so we are working hard on your behalf. Again, we sincerely apologize to you as it relates specifically to the delays in getting results. But I can assure you that we are working to remedy the situation as soon as possible. I thank you. And I want now to hand over to Dr. Anton Best to continue in terms of the health aspects of this matter before we go to the Minister of Tourism, who will speak specifically as it relates to the issues of tourism related. I thank you.
Thank you very much, Minister Walcott, and good evening to all persons in Barbados. It is indeed my pleasure to represent the Ministry of Health and to give you a statistical update on the COVID-19 situation in Barbados. As of January 8th, that's Friday, January 8th, we conducted 1,400 tests yesterday, and of the 1,400 tests that were conducted, we diagnosed 23 persons with COVID-19, 14 being men and 9 being women. Yesterday, we discharged 30 persons from isolation. However, I have to add that we have 115 tests that are outstanding or pending, and the tests could be pending for more than one reason. Sometimes the tests are positive but haven't been validated, and then there are other reasons for tests being pending, simply not having been conducted. So in total, since March of 2020, we've had 808 cases of COVID-19 in Barbados, 347 of those being female and 461 being men. In terms of the total number of tests conducted, that number is just under 82,000. In terms of the numbers currently in isolation, we are at 428 persons in isolation across various facilities, and Minister Walcott in his opening address would have touched on those facilities. In terms of the clusters that we're looking at the prison, we have 56 staff, or 17% of the staff population being COVID positive, and 137 inmates, or 18% of the inmates being positive. Minister Walcott in his presentation would have mentioned that the second tests that are due for the staff as well as the inmates have been conducted, but we only have preliminary data. When we get definitive data, we will present that tomorrow. In terms of the prison, we have 37 cases associated with this cluster in the community. So when we add the 137 inmates and the 56, that's in the entire population of persons related to the prison, but then they're linked to 37 cases in the community. Related to this outbreak or cluster is the bus crawl, which has 14 cases. And then we have on the West Coast, we have 67 cases in that particular cluster. And I also have to note that there are small clusters that we have not yet fully defined, but there are many small clusters out there contributing to the large outbreak that we experienced just over a week ago. So overall, the numbers are trending down, but we're not out of the woods yet. Vigorous contact tracing efforts continue, and we've made significant headway, but please appreciate that this is a very intense and laborious process, and it's going to take us time to fully outline the clusters and the index cases and to have a solid idea as to how this outbreak started in Barbados that we did not appreciate, that we did not anticipate beyond the wildest dreams. I also want to apologize on behalf of the Minister of Health, Lieutenant Colonel Jeffrey Bostick, and the staff of the Ministry of Health for the delays that we've been experiencing. As Minister Walcott would have mentioned, this was a seismic shock to our system. We had systems in place that were working for many, many months, but with this massive outbreak of nearly 200 cases in one day, in one 24-hour period that we detected, it really put a significant strain on our systems. And in some cases, some of our systems that were working before broke down. So we are in the process of building back systems, improving systems, and implementing new systems if necessary. So just an apology on behalf of all of us in the Ministry of Health. We are working assiduously to resolve all of these issues, and Minister Walcott would have touched on those. And certainly in the question and answer section, I will be responding to any queries that would be put forward. Thank you very much, people of Barbados, and Minister Walcott.
Thank you, Dr. Best. Dr. Corey Ford, I forgot to mention you when I started. I should have said that you were on Zoom. I'm only now seeing your name on the screen in front of me. My apologies. Is there anything you want to add in terms of the patients? Are there any ill patients? We've been very fortunate. Our numbers have risen, but our last death was in May. Perhaps you want to speak as it relates to any ill patients and in general the state of the persons in Dodds Prison. Dr. Ford.
Thank you. Good evening to all Barbadians in these difficult times. I'm just going to give you a brief update on what's going on at the facilities across the country, isolation facilities. I'm sure you're quite interested. At Harrison's Point, in our primary isolation area, for those who don't know what that is, that's the area where we have our most sick people in country at present. We have a total of 14 persons, and around the ages between 20 and 63. Most of them are in the age 40s, 6 males and 8 females. Interestingly enough, 3 of those are Barbadians who are actually, who I mentioned in the last press conference, who are actually severely ill at that time, and they've been downgraded to moderate in terms of illness and they remain on oxygen therapy. There's one British national who I mentioned at the last conversation who was severely ill, and one other British individual, a male, and he's actually improved significantly from severe. He's also moderate. So we've had a significant improvement in terms of our management of our persons who are in the primary isolation area. So that's great news for us. At Her Majesty's Prison, we had only one admission to the hospital within a very short period of time. I was able to set up a high dependency area, practically a hospital area within the prison setting. And we had admission to that area, a 17-year-old male who was COVID positive, who was admitted initially as severely ill. And I think, on review of him, we really thought it was not really due to his COVID, but really due to his asthma. We actually treated him, and I'm happy to say this evening, after that initial severe presentation, he's actually discharged from that area. At our Blackman Gollop facility, patients there actually are quite well, and we've designed a process from Harrison's Point. So if you're much better and you're quite well and you're quite many days into your illness, we will transfer you across to that facility. And I'm happy to say today, give you a few figures that we have had some discharges from that facility, a total of 24 today. Among those were 3 of those who were affected BDF on country, and 15 of the prison officers have been discharged. So I think we are quite happy about that today. So that's the update, certainly from our isolation facilities across the country. Thank you.
Thank you, Dr. Ford. I'm now going to ask Minister Lisa Cummins, Minister of Tourism and International Transport, to address you on some of the matters pertaining to tourism in relation to COVID-19. Minister Cummins.
Thank you. Thank you very much, Minister Walcott. Good night to the people of Barbados. Good night to our visitors to our island. I would want to first begin by expressing the appreciation of the Ministry of Tourism and the entire tourism community to the Ministry of Health and the Ministry of Health officials who have been working very closely with us. We know that you have been working throughout the day, throughout the night, every day, every week, making sure that you have kept our nation safe. You've been able to keep our nation safe within our communities, those of us who are living and based here in Barbados, but you've also been able to provide stellar service to those who are visiting with us from their own homes abroad, and we would like to express our appreciation to you on behalf of those persons. Now, Barbados has a long history of hospitality. We have a long history of welcoming people to our shores, and many of the challenges that Minister Walcott spoke about earlier that have affected us as Barbadians, many of those persons who are based here who have been challenged by the delay in the return of test results have also affected those persons who are not based in Barbados and who are visitors to our shores and really who are our guests. And we would want to offer unreservedly and without hesitation our apology as a government to all of you. This has not been easy. It's not been easy for any of us. It's certainly not been easy for Barbadians who in some instances, and we remember when we as Barbadians were locked in our homes and when we were in lockdown in March and we couldn't go outside except on the days, I think Minister Walcott spoke earlier about a potential return to the alphabet system, and we saw the impact that it had, even the mere mention of it today, where Barbadians began to panic about the thought of not being able to go outside. And so the notion that a visitor to our island, much like we are to other people's shores on more than one occasion, would be in a room for any extended period of time, in some instances 5 days, 6 days, without having a clear indication of their COVID status, and in some instances being there in small spaces with their families, including young children, it has been extremely traumatic for many of you. Prime Minister Motley, myself, all of the officials in the Ministry of Tourism have been dealing with an inundation of calls, messages, in some instances outright SOS calls. We apologize to you. We understand how you feel because we would not want it for ourselves. And I want to share with Barbadians who in some instances may not be seeing or hearing all of these things, even though I know that on social media, some of our visitors have been sharing their challenges with being in restriction. We have people who have come to our island, as we have marketed it for many, many years, to be able to get married on their beaches, on our beaches. We have persons whose wedding dates have been rescheduled more than once, more than twice, and who have not been able to get married to the love of their lives. They wanted to be able to do it here in Barbados. And the delay in getting test results has affected even the most inspiring thing, like a wedding between two people who came to our shores to get married. We've had families who came with their children, who were struggling with lockdown overseas and who were dealing with depression and emotional challenges. And they too have been affected. You too, if you're visitors and you're listening to this, you too have been affected, and we hear you, we see you, we understand what you have been feeling. And we are going to be working very closely with the Ministry of Health to ensure that if you have been on island for more than 72, you've been on island and your test results have been outstanding for more than 72 hours, we are going to be making sure we make the wrongs that have been done right. It's not intentional. I think Minister Walcott was quite clear, and he was absolutely right. These are challenges that we know are happening all over the world. But we are a small island. We aim for the top, and sometimes we don't always make it there, but we're committed to always trying. And so we are going to be working with you. We have actually stood up a call center. It will be available 24 hours a day. Over the next 48 hours, we will be staffing it with our most senior officers so that we're able to deal with the initial challenges that you've been dealing with. We want to encourage you to call that call center, 628-4150. 628-4150. Let me just put it in for those persons who are not based here in Barbados. 1246-628-4150. If you're in your hotel and you're hearing us, please feel free to call that number. Share with us when you arrived, how long you have been awaiting a test result, when you had the swab taken, who took that swab, and we will be working closely with our partners in the Ministry of Health to ensure that we can get that test result back. But there are those people who have come, some of whom have left. They have had to leave because they've not been able to get their test results at all, and they've spent the entire 6 days or 7 days in some instances in a hotel room unable to leave. We apologize to you as well. We want to be able to invite you back at the earliest possible opportunity when this is all over to enjoy what Barbados really has to offer. Don't give up on us yet. Barbados still remains one of the top destinations in the world, and when this is all over, we want to encourage you to travel back to Barbados to enjoy what we have to offer. But in the meantime, there are some of you who are still here, who are experiencing challenges, and in addition to working with you to getting these results out, I want to advise that the Minister of Finance, Prime Minister Motley, who has been dealing with these issues right along with us and who has been presiding over all of these meetings that Minister Walcott has said, and who has been receiving your letters as well, has also expressed her own distress. And it is for that reason that I wish to announce that if your results are outstanding beyond 72 hours, the government of Barbados will cover the cost of your hotel room until you are able to get those test results. We will be covering those costs. And for those of you who still feel inclined, and we know most of you want to be able to come back because you didn't come here to stay in your hotel room and you didn't come here to be watching all that Barbados has to offer from on the outside. We appreciate you for respecting our quarantine rules. We appreciate you for abiding by our quarantine rules and staying in your room, but we want to offer you an opportunity to come back. If you want to have an opportunity to come back to Barbados because you have not had an opportunity to see what we have to offer you, because you've not gotten your test results and you've not been able to leave your room, we want to invite you to make contact with us again at that call center, and we will be welcoming you back to Barbados. We will be offering you a return trip to Barbados again once this is all over. So there are two main takeaways here. Aside from the fact that we apologize to you because tourism is very much a part of our DNA here in the Caribbean and especially right here in Barbados, we want to make sure that we offer you the best that we have to offer. Things will happen. And when they happen, we will stand up and we will take responsibility, we will correct them. We are working to correct this one. But in the event that you are still unable to complete your time here with us on vacation or to see your family or your loved ones, as in the case of the person whose wedding has had to be called off, if you are not able to have those experiences here with us, we want you to come back. And we're offering you an opportunity to have a return trip to Barbados. Make contact with us at our call center. If your test results are outstanding, again, call the call center. We will be working with our teams to be able to give you your results. And I want to end just by making an appeal to my fellow Barbadians. We're very clear on what we want to be able to represent of our people and of our nation. We are a kind, warm, welcoming people. We appreciate being able to interact with people from all over the world historically. Let us trust our Ministry of Health officials to put the measures in place to keep us safe. Let us trust our enforcement officials to put the measures in place to ensure that those protocols are followed. And then when this is all over, let's join hands and hearts and welcome our visitors back to our shores in the way that we have done for generations. Because we, too, are visitors. We will visit others in time when this is all past, and we will welcome others back to us. Let us walk together. Let's get through this together, because everyone is fighting an entirely different battle, but it is the same battle. We're all fighting COVID together and ensuring that we can be the best that we can be. Thank you very much. I'm going to hand back over to Minister Walcott at this time.
Thank you, Minister Cummins. And ladies and gentlemen, we've coming to the end. I first want to thank Minister Cummins, Dr. Best, Dr. Ford for participating this evening. I want to again encourage you to be patient with us, to be understanding. We are dealing with these matters. I've explained them. And I want to also thank and commend the very hard-working staff at the Ministry of Health and Wellness for all that they have done. I want to encourage you, those of you who have not got your results and who might be feeling ill, to please call the hotline 536-4500. And those of you who are waiting for a second test, kindly remain at home as much as possible. Thank you and good evening. I wasn't told that question. I didn't know they had questions. Thank you. Apologies to the press. I didn't realize that there's anyone on for questions. Are there any questions?
Yes, Minister. A question for Minister Cummins. You mentioned that the government will be covering the cost of those persons who are awaiting that test for the last 72 hours. Do you have an idea of what that is going what is going to be the estimated cost to the public coffers for that initiative? In addition, could you give me an idea, with all this bad press and bad publicity as a result of persons expressing frustration awaiting for those tests, what type of fallout are you anticipating with regards to Barbados marketing as a destination?
Thank you. Thank you for that question. Let me start first of all with the first part. So we have a number of persons, the number we're still totaling, but we're somewhere in the vicinity of approximately over 230 persons approximately have been awaiting their test results, somewhere in that vicinity. But the number could actually be higher if we combine those persons who tested privately along with those persons who tested publicly in the polyclinic system. So that's the first summary. But in the first instance, what we're dealing with here, we have to be conscious of the reality of this. If many of us travel, we have a budget. We're traveling and we know we're going to be in a hotel. We're expecting to stay for 4 days, 5 days, and we budgeted for that. In this instance, we have a number of people who have written us to say, we have been in our hotel room for 7 days and we budgeted for 4 or 5 days, and the days continue to go on, and we have no more money. And we don't know where to go. We don't know what to do. And I don't think that that's something that we want for ourselves. And I certainly don't think that we would want to have persons who are financially embarrassed through no fault of their own on our shores, having invited them to come to Barbados. And so the Minister of Finance, who has ultimate responsibility for our coffers, is in a position to make a determination on what is affordable and what is not. And so I have every confidence that the Minister of Finance and the Ministry of Finance, certainly as we go into the next couple of days, that we will be in a position to manage the immediate numbers that we're dealing with. It's not a huge number, but every message, as you have said, that goes out on social media, that goes out in the press, that is bad coverage for Barbados, affects our recovery when that time comes. And so we have to be able to find that balance between dealing with the immediate situation before us and still also managing brand Barbados.
And this is part of my question regarding the anticipated fallout. I know you
Charlie.
appreciate that.
So in terms of the expected follow, I think you have to balance that. I think you have to balance that against the fact that our major source markets are simultaneously also in lockdown themselves. So you have the UK that has gone into lockdown, you have the US that is challenged by what's happening domestically, and you have the Canadian market. In some instances, the largest provinces are also in lockdown because they're dealing with significant surges and high infection rates. So it's not a single factor of what's happening here in Barbados, but in their own home countries, many of our visitors are not necessarily traveling. And I'll give you some numbers just to put that into context. At this time of the year, we're used to having between 220,000 passengers coming into Barbados on a monthly basis. This last month, we saw 18,000. So there is a significant difference between what would happen under ordinary circumstances and what we're dealing with now. And much of that is driven, quite frankly, by what's happening in our source markets, in our major markets overseas.
Colville?
Yes.
I know you don't want to hear me, but when I spoke at the beginning, when we were dealing with tourism, I specifically made mention to Barbadians who have come home to visit their families, etc., that this would also apply to them, those who've had to wait for a number of days in hotels and incurred additional expenses. So I expect that you will cover that in the story that you write. But you asked about costs. But I want to tell you, it has to do, what would it cost us now to repair our international reputation in tourism if we would allow this to happen, where we advertise and then we advertise something, and then when people get here, it doesn't occur. Point is taken, but just ensure we understand, but it is about balancing things. And in this case, you know the importance of tourism to Barbados, and we can't afford to destroy our international reputation as it relates to tourism. But make sure that you're right that it includes Barbadians.
We'll definitely do, Mr. Minister. But also, if you may switch gears quickly, we have TNT who would have confirmed that they have a strain of the new strain of the virus. We have Jamaica who have also made that confirmation. The last time we spoke, Barbados was still in the stage of ascertaining whether we have that strain. Could you give us an update on that, please?
Well, I've spoken twice about this. Initially, we had sought assistance from PAHO. Last time I spoke about it, I said we have now recognized that CARFA has the facility to do this. And I know that the lab was making preparations to send a number of samples there. I don't know what of the results have come back or if the samples have been analyzed as such as yet. But this is something that we are keenly looking at. Is that it?
I'm making room for someone else who wanted to ask a question, but apparently no one does. So, quickly, patient 0, any progress with that as well?
Dr. Best, I'll ask Dr. Best to respond to you.
So I would have mentioned in my presentation that we have identified 3 main clusters and many smaller clusters. I would have also mentioned that we're doing vigorous contact tracing efforts in order to get to that answer, who is patient 0. It may take us a few more days, it may take us a few more weeks, but considering the large numbers that we were not dealing with before and that we did not anticipate, you have to give us time. Trust that the work is being done. Additional resources are being allocated to the polyclinics that are doing this contact tracing, as well as all of the other systems are being augmented and strengthened in order for us to better understand what has happened so we can prevent and control further spread of COVID-19 in Barbados. So we don't have an answer for you as yet, but that is something that we're working towards at the Ministry of Health and Wellness.
This question about patient X and this interest and fascination with patient X. Have you read of a patient X in China, in the United Kingdom, in Italy, in the United States, in Jamaica? Have you yet read of a single patient X? I thank you. I don't believe you have questions. Do you have any other questions? I don't believe.
Yes, good evening. Lisa Lord from CBC.
Good evening.
Just wanted to know what's the status of the psychiatric hospital. We saw reports today that 2 staff members there had tested positive. Is this correct?
I don't have any knowledge of that.
Yeah, unfortunately, Ms. Lord, I don't have an update on that. As soon as we have an update, we will put something out in the press regarding the psychiatric hospital, but it's something that we're paying very close attention to.
Okay, I believe that we have come to the end now. I don't know if there are any final comments. If not, we come again. I thank you all for your attention, and I ask you to be patient, to take your necessary precautions. Remember your mask. Remember your hand washing and sanitizing. Remember, most importantly, your physical distancing. Thank you and good evening.